and welcome. I'm Mary Bassett, and I direct the FXB Center for Health and Human Rights at Harvard University. And I'd like to thank all of you for joining us at today's webinar. We just heard that over 400 people registered, and so we expect we have a couple of hundred people with us. The title of the webinar is Health Under Siege, from Sheikh Jarrah to Gaza. While our focus today has an emphasis on health, our conversation will reflect the diverse academic disciplines represented by all of these groups across Harvard: human rights, democracy, governance, and religion, and our shared dismay at the violence and the decimation of Gaza. Palestine has featured in the FXB Center's work for many years, and our conversation today cannot be separated from the region's history since 1948. Albina Dubois-Rouvray, who founded FXB and whose generosity endowed the center now over 25 years ago, has long engaged with Palestine. And Dr. Jennifer Leaning, who preceded me as director, has deep ties with human rights activists in the region, including Palestine, and has been stalwart in making clear that military conflict always makes protection of human rights more and never less important. These connections, along with those of Dr. Jacqueline Baba, Drs. Bram Wispoui and David Mills and Lara Germanis, have all made today possible. I personally have not worked in the Middle East, but as someone who focuses on US structural racism and has witnessed how in the United States calls for public safety has been used as a rationale for police violence directed especially against the Black American population, there are many resonances with the current conflagration, and demands to submit or die carry a terrible price, but do not deliver safety. In all the horror that reigned for 11 long, grueling days, 12 dead in Israel, over 200 lives, I've seen 230 lives lost in Gaza and Palestine, including 60 children until the ceasefire last night. So it is very important for all of us to enhance our understanding of the situation, and we're privileged to have a really wonderful panel. So I'll turn it over now to Bram Wispoui to get us started. Bram, over to you.
Thanks so much, Mary. And just a couple ground rules for questions. We're going to go ahead and use the Q&A box at the bottom of Zoom. So put your questions in there, and hopefully we'll have some time to get to them at the end. I'm going to actually just do, some fairly brief introductions here, because I really want to give as much time as possible to our speakers today, who are really fantastic speakers, as Mary was mentioning, and experts in their field and leaders in their field. So, I think I'll start first with Yasser, who's, I think, having some internet issues here, which is not surprising as he's currently in the Gaza Strip, but he's Director General of the Gaza Community Mental Health Program. We'll speak as from that position, as well as just a human living in the Gaza Strip. Second, we'll have Weeam Hammoudeh, who is an assistant professor at the Institute of Community and Public Health at Birzeit University in the occupied West Bank. And finally, we have Rashid Khalidi, who's the Edward Said Professor of Modern Arab Studies at Columbia University. Very, very grateful to have of each of these Palestinians with us today to speak about the situation. And so I'm going to start with you, Rashid, and going to give you a fairly daunting task, but one I know you're up to. So it's impossible to truly understand the events on the ground in Palestine over the last few weeks without being able to contextualize this, without understanding the history, right? And this is the part that we're so often missing when this starts making headlines in the United States. So walk us through that history, the frameworks, the policies that have led us up to the point we're at now, right, where forced displacement in Sheikh Jarrah, attacks on Al-Aqsa Mosque, and then finally in Gaza. How did we get here?
Thanks for having me. I'm still have trouble with that damn mute button. I'm pleased to be here, and I'm grateful to you all for organizing this. because I think the health and mental health aspects of this are really quite crucial. Dr. Iyad Sarraj, who I think helped found the Gaza Mental Health Clinic way back when, was a very dear friend of mine. And it was through him that I learned of some of the mental health aspects, which I hope we'll touch on today. I think it's important not to be fooled by what the media and a lot of apologists for Israel prefer to do, which is to have this sort of perpetual beginning. The first rocket flies and that's where it started. That's not where this started. This started in Sheikh Jarrah. This started in Jerusalem at the Al-Aqsa Mosque. And in both of those cases, we are talking about issues that are deeply tied to longstanding root causes of conflict in Palestine and Israel. Long before the first Hamas rocket was ever fired, people were being dispossessed. And what happened in Sheikh Jarrah, what was happening in Sheikh Jarrah, what has actually been happening in Sheikh Jarrah for more than a decade, and in other neighborhoods in Jerusalem and other parts of the occupied territories, in terms of dispossession, theft of land, or the assertion of claims attendant upon the expulsion and dispossession and eviction of people from their homes or from their property, has been an ongoing dynamic for more than 70 years in Palestine. The Nakba involved a mass dispossession and displacement and eviction of 750,000 Palestinians, who are the ancestors of people who are today in one way or another exiled from their homes and their properties. And what happened in Sheikh Jarrah in terms of a extremist settler group making a property claim in that neighborhood reminded everybody in Palestine of the fact that this has been going on for many, many decades. It did not start 7 or 6 weeks ago in Sheikh Jarrah. It has been happening in that neighborhood for many years, but it's been happening in East Jerusalem ever since the occupation of 1967. And it's been happening in other parts of Palestine, those that are, in other words, now part of the state of Israel, since 1948. So in each case, whether we're talking about Sheikh Jarrah or whether we're talking about what later on happened in Jerusalem, in the Old City, and in particular, in the Haram al-Sharif, the vast esplanade that surrounds the two mosques, the Dome of the Rock and the Al-Aqsa Mosque. We're talking about issues that go way back. The one being, as I've said, dispossession, the other being essentially the supremacy of one group over another group. I think you have to put yourselves into a framework outside of Israel and Palestine to consider what happened at the Al-Aqsa Mosque. The Al-Aqsa Mosque is the first direction of prayer of Muslims. Before it changed to Mecca, the first direction of prayer was Jerusalem. Ula al-Qiblatain, the first direction of prayer. It's also the third holiest place in Islam, in Arabic, Thalith al-Haramain. This is not just some mosque. It is actually perhaps one of the oldest mosques in the world. It was built by the Umayyads in the late 7th century, 680s probably. So only a few decades after the Muslims took Jerusalem from the Byzantines. And it is an area that's supposed to be governed by something called the status quo, on which Israel has systematically encroached ever since it occupied Arab East Jerusalem in 1967. I remember when I used to live about, 40, 50, 60 meters away from the Haram. Israel controlled access, but the idea of Israeli security forces storming the Haram was inconceivable. Israel has systematically encroached, in effect, imposing its control and imposing its rules on the third holiest place in Islam. This culminated, as we know, in repeated on repeated evenings, Israeli security forces storming the esplanade, storming, in other words, the Haram, the enclosure around the mosque, and most egregiously on the last 2 days before the fighting actually started between Gaza and Israel, storming the mosque itself, attacking worshipers at prayer on one of the last nights of Ramadan with tear gas and stun grenades. We've all seen the videos of Israeli soldiers kicking the doors open and firing these tear gas and stun grenades. And whatever they may have been doing out on the esplanade, whatever may have been happening, they were then entering into the third holiest mosque in Islam on a Ramadan night and firing tear gas and stun grenades. Imagine that happening in Temple Beth El here on Fifth Avenue, Temple Emmanuel Imagine that happening in St. Peter's Basilica or St. Patrick's on Fifth Avenue. Imagine a major, in fact, in the case of the Al-Aqsa, one of the most important mosques in the whole of Islam, having soldiers kicking the doors open and firing smoke grenades and tear gas grenades and stun grenades at the worshipers. You can only imagine how this affected ordinary Palestinians, not just in Jerusalem, not just in the West Bank, not just inside Israel, where there are a fifth of the population of Israel is Palestinian Arab citizens of the state, and not just in the West Bank, but all over Palestine. And in fact, how it must have affected people throughout the Arab and Muslim worlds. So these are the triggers. And in both cases, whether we talk about the old city of Jerusalem and Al-Aqsa, or whether we talk about the planned evictions and expulsions of people from their homes in Sheikh Jarrah, we're talking about issues that have deep roots in the Palestinian psyche, in Palestinian trauma. The case of Sheikh Jarrah is particularly poignant because the families that have been partially evicted or have been evicted in the past, and those that were about to be evicted, dependent on a Supreme Court decision, were themselves refugees from Haifa and Jaffa in 1948, people who lost their homes, lost title to their homes because Israeli law deprived them of that title, would not allow them to return, would not allow them to reclaim or be compensated for their property. And we're now being told that someone else held title to their property and was about to dispossess them yet again. So this struck a nerve for Palestinians, for whom the expulsions of 1948 are a seminal moment in the national psyche, in the national consciousness. Everybody has these experiences in their family. There's not a Palestinian among the 10 or 12 million Palestinians. There's not a single Palestinian who doesn't have this experience, even if they themselves or even their parents and grandparents did not experience it. We all know about it. I didn't experience it. I was born after the Nakba, very soon after. But I know that my grandparents were forced to, and some of my uncles and aunts were forced to leave my grandfather's home near Jaffa. Everybody knows about these things. And so seeing this enacted again and again and again and again, people being dispossessed again and again and again, which has happened repeatedly in the history of many Palestinian families, was just, it just finally reached a point of being intolerable. And that's why you have had unrest, demonstrations, protests all over Palestine, inside Israel, among the Palestinian communities there, in the West Bank. Over 20 demonstrators have been killed in the West Bank in the last week or so. 21, I think, is the last number I saw, by live fire by Israeli forces. In some cases, most cases, in fact, where the Israeli forces suffered no casualties. So the Israelis are shooting down, killing kids who throw back smoke grenades or throw rocks at them. This kind of anger, this kind of response to these egregious actions, these provocative actions by the Israeli government. And I have to say, either the result of the most extraordinary incompetence and negligence on the part of the Israeli minister who authorized the attack on the mosque, or on the part of the Israeli government in sending security forces to support the settlers who were trying to take over homes in Sheikh Jarrah, is probably part of a cynical process whereby the prime minister and his allies are desperately trying to stay in power and are willing to use any means to entice the extreme right-wing members of the Knesset, whom they need to form a governing coalition and whose supporters they need to vote for them in case Israel is forced to go to a fifth election in a little over 2 years. So there was a cynical manipulation of this. One of those deputies, in fact, set up an office in the street in front of the houses where these people were to have been evicted. And in effect, using this as an electoral platform, using this as a political platform. I want to mention one other thing that has emerged from this, and which I think is really important. And it's become clear in what's happened, not just during the 11 days of fighting, rockets and bombing and so forth, but in the week or two that preceded it, the 2 or 3 weeks, in fact, that preceded it, in terms of unrest in Jerusalem and in terms of the issues around Al-Aqsa. And this is that Palestinians have not just suffered from dispossession. They've not just suffered from an attempt to establish the supremacy of Israel as the only nation in Palestine. I mean, this is the language of the 2018 nation-state law passed by the Israeli Knesset in July 2018, and which said there's only one people with the right of, uniquely with the right of self-determination in Israel. And since Israel controls everything from the river to the sea and has effectively annexed the West Bank and East Jerusalem, what we're talking about is a statement with constitutional force. This is a basic law that there is only one people here, and our supremacy, our settlement. Settlement is also mentioned in the law. Settlement is a national task, meaning supplanting Arab communities with Jewish communities. This is the way it's going to be, that law says, and you just have to accept it. So Palestinians were not just rising up against this, and as evidenced in Sheikh Jarrah, they were not just rising up against the way in which their holiest place is being treated. Incidentally, worshippers going in to the Holy Sepulchre, the holiest place in Christianity, the place where Christ is supposed to have been crucified and to have been buried. Worshippers attempting to enter the Holy Sepulchre before Orthodox Easter, which was, I think, a couple of weeks ago, maybe 3 weeks ago. Their attempt to worship was interfered with, and they were attacked by extremist settlers. So this kind of treatment around the places the most holy to Palestinian Muslims and Christians, and this attempted dispossession, reminding them of all that has happened since 1948 and then since 1967, touches on another point I just want to mention in conclusion, which is that not only have these things been done to the Palestinians, but they have also been denied what Edward Said called permission to narrate. The Israelis are the ones who frame everything in terms of what I started with, perpetual beginnings. A rocket is fired from Gaza, and that's the beginning. The fact that the entire population, almost the entire population of Gaza, is made up of people who were driven from their homes in 1948 in the areas surrounding Gaza, whether the Beersheba area, whether Ashdod, Asdod, whether Ascalon, Ashkelon. I'm giving the Arabic and the Hebrew names of places that have been, in the Israeli term, Judaized, and whose names have been Hebraicized. These are people who came from those regions, the regions at which rockets have been fired in the last 11 days. That's not part of the story. The siege of Gaza is not part of the story. Gaza has been under siege since 2007. Fuel, construction materials, medicine, medical equipment, educational equipment, books, food, you name it, has been, the entry of all of those things has been controlled by Israel, sometimes shut off and quite frequently limited. People cannot go in or out without permission from Israel. People have died waiting for permission to go out of the Strip for medical treatment. People have lost their admission to universities because they never got permission to leave. Most of the people in the Gaza Strip have been imprisoned there for the past 14 years. It is an open-air prison. That is not part of the story. The Palestinians don't have permission to narrate that. The newspapers and the cable television networks start with the first rocket. It's a perpetual beginning. It begins when the Israeli narrative says it begins. The Palestinian narrative would take you back a lot further. One of the striking things that has happened as a result of what was happening in Jerusalem, whether at Sheikh Jarrah or in the Old City or around Al-Aqsa, and that has later, I think, happened to some extent during the fighting between, the Israeli attacks on Gaza and the rocket fire out of Gaza, is that to a small degree, the Palestinians have seized back permission to give at least their narrative of things. I'm not saying that that narrative dominates. It's not hegemonic by any means, as the Israeli narrative has been hegemonic for generations and generations and generations. Something carefully crafted, something assiduously developed, something that became extraordinarily convincing, and that most Americans who innocently believe that this is the story. It's rooted in the Bible. It's rooted in the miraculous redemption of the creation of Israel in the wake of the horrors of the Holocaust. Israel has always been defending itself. The Arabs want to destroy it. There's a whole litany of myths and half-truths that make up this tissue of this narrative. And Palestinians simply have not even had a chance to put forward their version of things, which most cases is in fact a lot more true than much of what we've been told. And one of the most striking aspects of what has been happening, in my view, in the last several weeks, is that the Palestinian narrative has broken through. It's broken through partly because there's an increasing consciousness in the United States of the fact, not so much that just that Israel is engaged in settler colonialism in Sheikh Jarrah or in the West Bank, but that because we are a settler colonial country, because the origins of the United States are in settler colonialism, this is something we can understand in a profound way. It's not just the fact that Palestinians understand that they are being systematically discriminated against by a legal system that is stacked against them, whether in the occupied territories, whether in Jerusalem, or whether inside Israel. Americans are beginning to understand that, but they are understanding things that have to do with their own experience in terms of legal structures of discrimination like Jim Crow, in terms of biased and heavy-handed policing, which is applied only to Black or to Latinx or to Native American or to other minority populations, and not to, for example, the people who stormed the Capitol on January 6th. The linkages, in other words, between the kinds of things that the Palestinians face and the kinds of things that are part of American history. I mean, Jim Crow, segregation, slavery before that are part of American history. And you can pretend, oh, no, they're so different. Israel is in fact a democratic state and it has a benign occupation, but you can fool some of the people some of the time. You can't fool all of the people all of the time. And particularly the younger generation, which is not limited by the filters of the mainstream corporate media, and who have access through TikTok and YouTube and a million other platforms, many of which I've never even heard of, I'm sure, are seeing things that cannot be unseen, are learning things that cannot be unlearned, and are making connections which enable them to understand what's happening in Palestine and to see the Palestinian narrative in ways that never happened before. So I was given 20 minutes to give, 15 or 20 minutes to give a full background of the history. I couldn't possibly have done that in 15 minutes. So what I've tried to do is just stress a few of the through lines from 1948 or from 1967 to what happened in Sheikh Jarrah, what happened in the Al-Aqsa Mosque, and how that in turn triggered off not just the extreme violence that we then saw thereafter, but how that in fact has galvanized the Palestinians and galvanized support for them in the Arab world in ways that your media will never show you. You have no idea what's going on with social media in the Gulf, and they're not gonna delve into it. They're gonna like lemmings. The media will go on to the next story, whatever it is. But I assure you, there have been shock waves that have gone out throughout the Arab world, throughout the Islamic world, throughout many parts of the world. We're beginning to see it in the United States as a result of what has been happening in Palestine and Israel over the past couple of months. I think that these are seen by Palestinians, are increasingly seen by other people as linked to a through line that goes back to the core issues. The diplomats and the politicians are going to pretend that with a ceasefire and with a new peace process, a term which is the most vacuous, vapid, Orwellian lie in the vocabulary. It's a process, it's not peace. They've been at it for 40 years and there's no peace. That's not a peace process. That's a maintenance of the status quo and helping the Israelis to cement their control of the occupied territories process. That's an honest description of what the United States at least has been up to. But I think that people are beginning to see through that. And I hope that this brief introduction I've given you is helpful to all of you as you talk about some of these serious health issues that I'm looking forward to hearing about. Thank you.
Excellent. Thank you so much, Rashid, and for setting that context for us and hopefully whetting the appetite for many people. Thankfully, you've written many incredible books that go into much more detail about the history that I recommend people check out. I want to turn now to you, Weeam, and to think about all of this history and context we just got, this acute on chronic dispossession and displacement of the Palestinian people, which is at the root, right, of the conflict, as we just heard. How has that impacted health, right? Health systems I'm thinking about. You have a situation, 70% of people in Gaza are refugees, more than a quarter in the West Bank. and have been under occupation since 1967, as we heard in these areas. What has that meant for health systems, for thriving?
Thank you, Bram, and thank you for everybody that also helped make this possible. Yeah, so I think the context that Rashid provided is really important to actually keep in mind. I'm going to focus maybe a bit more on the areas occupied since 1967, so the West Bank and Gaza, including East Jerusalem. But it's not to say that the situation is rosy for Palestinians in Israel, and I think maybe we can get at that a bit in the discussion. So it's important to actually keep that in mind. So up until between 1948 and 1967, the West Bank was controlled by Jordan, and so fell under the purview of Jordan in terms of health and health services, while Gaza was under the control of Egypt. And then what happened in 1967 with the Israeli occupation was the West Bank, with the exclusion of East Jerusalem, was actually then administered by what's called the civil administration, but it's actually a body that's part of the it's a body that's part of the Israeli military. So the civil administration was responsible for health services in the West Bank, with the exclusion of East Jerusalem and Gaza. And I think it's also important to remember that here, this is in 1967, was also when Israel declared East Jerusalem part of Greater Jerusalem and actually illegally annexed it. And so this, this is parallel with that. And so Palestinians in East Jerusalem at that time were actually then included as part, or their services were provided to them as part of the Israeli Department of Health, while Palestinians in the West Bank and in the rest of the West Bank and in Gaza were actually provided services through the civil administration body. And if we think about, and I think what's important to think about here, and I won't get into too much detail, but just if we think about like international law and the responsibilities of occupying powers, they're actually supposed to provide a reasonable quality of health that is similar to the population, and which wasn't actually the case. So if we go back to reports, and if we go back to some of the statistics that from that period of time, and I'll just mention a few. So if, for example, in 1986, the expenditure for the West Bank and Gaza Strip as a whole did not exceed $30 per person per year. Okay. And when we compare that to what was actually for Israeli citizens, that came out to be $350 per person per year. So this is, this tells you that we're actually starting out with like a very unequal system from the beginning, despite responsibilities under international law and whatnot. In 1975, for example, the whole budget for the West Bank health services was equivalent to 60% of the budget for one 260 bed Israeli hospital. These numbers are telling, and at the same time, what we need to remember is that during this time, Palestinians actually had to pay taxes. Like, it's not, this, and I think sometimes also some of these measures that are taken by the Israelis, they're framed in terms of, Israel is doing this humanistic thing by providing services, but they're actually paying taxes at the same time, but they're getting subpar services. And during this time, and given like the inadequacies in terms of the health system, and with time actually, and it's important to remember that what was actually being provided by the civil administration only met less than half of what was actually delivered in terms of health services. So the remainder was covered through private services, through UNRWA, which has been operating since 1950, and later on, it was actually being provided by these health action committees that now have become more formalized into Palestinian NGOs and other charity organizations, including in East Jerusalem. And one other thing, just to kind of give you a sense of like this parallel system running at the same time. So while the budget that was allotted for services for Palestinians was separate from the Israeli budget, about 40% of the budget that was set aside for Palestinian hospitals, for example, actually went back into the budget for Israeli hospitals because most of the services needed were not actually available in the Palestinian hospitals. So there was very little that was actually done in order to develop services to make them more self-sufficient, and oftentimes Palestinians really Palestinians in the West Bank and in Gaza actually depended a lot on hospitals in East Jerusalem. So they're Palestinian hospitals like Maqasid, also Augusta Victoria or Mortality, that had been in Jerusalem for a while and were actually, some of them built by charity organizations, either Christian or Muslim. And so this is sort of the starting point. And then when with the Oslo Accords, when the Palestinian Authority comes in, there was an effort to actually, build up that infrastructure for healthcare. There was also some, like I mentioned, some of these organizations that had started forming in the Intifada during the first Intifada in order to cover some of the needs of health services became more solidified NGOs and provided some of these services. But at the same time, there are important constraints that are actually imposed through the different agreements, including the Paris Protocol. So there are economic restrictions in terms of what can actually enter and all the channels that has to go through, and that actually does influence health. And one small example is if we're thinking about pharmaceuticals. No agreements can actually be made between the Palestinian Ministry of Health and other, like, for example, drug companies without approval of the Israelis. And so what that means oftentimes is that these medicines need to be approved by the Israeli Ministry of Health. They can't make agreements, for example, with neighboring Arab countries oftentimes, with very few exceptions. The costs for drugs are much higher than they could potentially be because they're based on the Israeli economy. And if we're thinking about in terms of income levels, Palestinian income levels are about a quarter or less of what they are for Israelis, but what we actually have to pay for drugs, for example, is very expensive. And then there's also this other issue of, like, there's a whole list of materials that are considered dual-use materials that are not allowed into the West Bank or the Gaza Strip. And why that's important for healthcare is that, like, that's important because that actually limits the ability of the health system or the health sector to develop. That includes pharmaceutical development and potential independence. That also includes key equipment that's used, especially for cancer treatments, and that's like radiotherapy. So those any radiotherapy equipment is actually not allowed in the West Bank or in the Gaza Strip. So Palestinians can only access these treatments either in East Jerusalem or as their Israeli hospitals. And what this means is that this further cements the dependency on the Israeli health system. And so we talked about 40% of the budget going to referrals. Right now, about 40% of the Ministry of Health budget as a whole goes to referrals. Less than 20% of these referrals are to Israeli hospitals, but they account for 37% of the budget of referrals. And then there's and so you're talking about this, structures that further cement dependency and actually prevent you from having any sort of independent health system that can actually stand on its own 2 feet or really develop and thrive. And so this is one side of things. The other side of things is that the structures of occupation themselves, the geographic fragmentation, really limit health services. They limit access to health services. So we're talking about a relatively small geographic area, but at the same time, given the mobility restrictions and given the other restrictions, what you end up having to do is you have to provide services in lots of areas and actually build this kind of infrastructure because you can't actually guarantee people's ability to move from one place to another. Just to give a sense, there are at least 140 fixed checkpoints within the West Bank, and it can be an upwards of 2,254 flying checkpoints, so that at any given point, mobility can be restricted. And so this limits access. There are restrictions also in terms of the mobility of ambulances. So from a WHO report in 2018, 84% of 1,462 journeys of ambulances actually had to had to go by what's called the back-to-back procedure. So the ambulance, the patients in the ambulance had to be delivered to another ambulance on the other side of the checkpoint, and these are delays, and especially in critical cases, these can actually have a very negative impact on the health outcomes of people. The other thing is in terms of access, like, so and then if we focus especially on Gaza, the destruction to health infrastructure, what we've seen also in this latest iteration, but we've seen it over time. And even if we're talking about the restrictions on like what can go in or out, especially in the last 14 years since the siege on Gaza, it's been a lot more severe. And that's also meant that more people actually have to rely on services outside of the Gaza Strip. And so they have to get Israeli approved permits, because mobility of Palestinians between the West Bank and Gaza Strip, within the West Bank, and between and to other parts of Palestine are also restricted. And the latest report that was actually published by the latest monthly report said that 30% of permits were denied, and this is for patients. The percentage for companions is usually higher, and sometimes reaching 70 to 80%, and typically higher in Gaza. This number has also fluctuated. Sometimes it's actually peaked at 60 to 70%. There was an analysis that was conducted by the WHO, and this was also included in that 2018 report, which showed that for cancer patients who were initially denied their permit or faced delays in receiving their permits were more likely to actually die of cancer. And so we're not talking about these trivial things, and we're talking about these diseases. And so this is just in terms of like access to services and whatnot. And I mean, maybe I think we'll discuss this a bit more later on, but there are other things in terms of, like, for example, land confiscation, dispossession, which has especially been rampant, like in Area C in the Jordan Valley, areas that are also like the food basket of most of Palestine. And so you're seeing this land being confiscated, while at the same time food insecurity, the prevalence of food insecurity has increased, especially in Gaza over time. Home demolitions. So I think one of the things that, for example, during the pandemic that kept coming up was like for Gaza, for example, we're emphasizing hygiene and water. Over 90% of the water in Gaza is not suitable for human consumption. That's been the case for years. The UN has been warning about it for years. We saw, for example, even in efforts by the Ministry of Health in responding to the pandemic, some of these efforts were actually strained by Israel, with delays in terms of getting PPE and delays in testing kits. We see now, like, there's been a lot more attention being paid to this medical apartheid, especially when it comes to the vaccine. So you're talking about only about 2.5% to 3% of the population was actually being vaccinated. It's a little bit higher in the West Bank, so maybe between like 5 to 7%, depending on numbers, compared to over 60% in Israel, and over 80% if you're actually talking about the adult population that qualifies for vaccines. And so this is another thing, and we see it in all the different indicators. And I don't want to take up too much time, but then and so this is just in terms of like health services, but then there is this other side of it, especially if we're thinking about the broader structural determinants of health that have become a lot more popular, especially in the public health literature. And so these are the conditions that people are actually born into, they live under and grow under. All of these conditions, like, so you're talking about constraints on livelihoods, you're talking about dispossession, you're talking about land confiscations, just the stress of everyday life that the literature has shown us that over time can actually, take you to a disease, whether it's mental disorders or physical diseases, and those two are also connected. And I think Yasser will speak a lot more about these things. But it's just the conditions of everyday life have created, these are structural conditions that really have an adverse effect on health. And if we're just, if we just look at some of the key indicators that we often look at in terms of health, life expectancy, for example, for Israelis is about 84 years compared to 74 years for Palestinians. So you're talking about, a difference of 10 years. This is a pretty big gap in terms of inequalities. The infant mortality rate in Israel is 2.5 infant deaths per 1,000 live births. In the OPT, it's 16.6. So we're talking about multiple times over. And there are other, there are other statistics that actually show these disparities. And even within Israel, the Palestinian population actually has worse health indicators compared to the Jewish Israeli population, and this has also been documented. And so we're talking about conditions that really, and I think my colleague Rita Jakaman also talks about like these conditions that get under your skin, the wounds inside, and they really do create conditions that have an adverse effect on health. Put people in situations of chronic stress that have consistently been shown to lead to adverse health outcomes. So these are not technical fixes. These are, and then I think addressing these issues is impossible if we don't actually address the underlying causes of ill health and disease. And I'll stop there. Thank you.
Thanks so much, Weeam. And I think, just like Rashid, you brought up another point of overlap there with the United States, right? And that chronic stress and that allostatic load, right? That it impacts, Black Americans to such a strong extent too, right? In terms of health outcomes. And I think, just as Rashid made that connection with our settler colonial history, it's really important. And I think, really, helps to make it clear to me as an American, what we're up against here. What's so shocking about so many of the examples you just gave is that this is really in the best of times, right? And so I want to actually transition, this is the chronic condition of the health system. What you mentioned, sort of taxing Palestinians, then giving only a fraction of the budget, less than 10% for health, and then requiring Palestinians to then pay 40% of their budget for referrals, because the materials aren't available. I mean, it's so absurd. If you think about that whole series of events and the economic extraction, right? It certainly sounds like frank colonialism when you hear it laid out like that. So thank you for making that plain. I want to move now, from that piece to really the last 2 weeks, and it's really been harrowing. And I personally can't even begin to grasp it, right? This is seen horrifying text messages, stories, videos from friends, from colleagues, from people on the ground. But I want to turn now to you, Yasser, and really just give you a chance to talk about what's been happening, what the last 2 weeks have been like, and then from there, would like to hear a little bit more too about certainly your work and the health impacts and the mental health impacts of health as well. But take us in, Gaza, over the last 2 weeks. You wrote some incredible pieces on what was happening and what it was like for you and your family, and some desperate pleas for international attention and action. But would like to hear from you now.
Thank you very much, Bram. Let me begin by thanking you and saying to everyone good afternoon and good evening from Gaza, Palestine. Thanks for the panelists also who are doing really great. And well, I'm not sure from where to start. Actually, there are two things that I would like to begin with. One is to give you an update on the statistics, and the other one is to tell you, or to try to answer a question that everyone keeps asking me, which is, how different this offensive, this attack from the previous ones? We had 3 attacks, and then we had the Great March of Return demonstrations, and then now we have this 11-day offensive. And then the question is, how is it similar? How is it difficult? As of today's afternoon, actually, we had a ceasefire at 2 a.m. morning, Friday morning, Palestine time. So it's already about 20 hours from there. So far, according to the CHR, there are 242 people who were killed, including 66 children, 38 women. Among the 38 women, there are 4 pregnant women, unfortunately, and then 17 elderly people. When it comes to the injured people, we speak about 1,948. 1948 people got injured. It's an ironic figure, but anyway. 25% of those people, their injuries were from moderate to severe, including 610 children, 389 women, and 102 elderly people. When we speak about the other things that were affected, we speak about 24 health facilities that were affected. And there are some ironic stories, about, I think it was the 18th of May, that the Rimal main primary healthcare center with the Ministry of Health compound was attacked, and that included the laboratory where the COVID-19 tests are made. It's just one laboratory in Gaza Strip. That was partially attacked, and then they had to stop the testing for vaccinations, testing for COVID-19. And then they said for people who were supposed to get their second vaccine, Pfizer vaccine was allowed only in that primary healthcare center in Rimal. They told people, now you need to go from tomorrow to a Jarrah primary healthcare center, which is another primary healthcare center in Gaza City. A few hours later, the Jarrah primary healthcare center was itself exposed to some attack because there was a house in a Jarrah area that was really bombed. And later on, they announced that, okay, we are working on fixing the laboratory, and it started to, the lab, and then it started to operate again. Now, speaking of that, let's remember that 2 weeks ago, the main concern in Gaza Strip was COVID-19, like in another place in the world, In GCMHP, our concern was the main people who were calling our toll-free line, or the main people whom we were meeting either in the community or at community centers. Their main difficulties were, or challenges were two. One are related to the economic conditions, and this is because the unemployment rate is in Gaza Strip is over 50%. When it comes to people below the age of 30, it's more than 70%. So almost most of the population is unemployed. Now, when it comes to the employed ones, 85% of the employed ones are unorganized employment, which means that they work from hand to mouth. It's just some sort of daily work, like a cab driver, like, someone who goes to the open market or bazaar and sells some goods, works with vegetables, something like that. So the restrictions that were made in order to stop the spread of COVID-19, which included social distancing and included closing of some of those open markets, actually most of them decreased the life, the economic life, the economic circle in Gaza Strip. And a lot of people were complaining how depressed they were, how anxious they were about just going on with their economic conditions and being able to provide either sanitation, sanitizers and those material needed, or simply food for their families on daily basis. And the second fear was mostly is how to deal with the children. We have on average 5 children per household, and we live in the most crowded, among the crowded areas in the world, with more than, I think, 13,000 persons in 1 square miles. And then how those children are now not allowed to leave their house because of measures related to the social distancing, and of course, because of stopping the education system. And we were just having to deal with the second wave, where about 35 to 40% of the people who tested, who went for testing, tested positive. So the concern was with COVID-19, and then the whole offensive started and took place about 12 days ago, and then the fears changed into another direction. A question that people continue to ask is how was it different, Because people, for example, heard that in one night, which was in the northern of Gaza Strip, about 160, I think, airstrikes took place at about 40 minutes in the areas of Beit Lahia, Beit Hanun, which is the northern area of Gaza Strip. And people were telling me, was it like what happened in 2008? Look, what happened in 2008 is that it was, I think, 11:22. I remember the exact time. It was a Saturday morning. And suddenly the whole area, wherever you can look. I live in East Khan Yunis, whether to the north, to the east, to the west, to the south. You see large smoke, clouds of smoke, which is a small resemblance of what we see in movies, that are related to the Hiroshima bomb, for example, the atomic bomb. It's very similar to that a mushroom-like, cloud. And it was a moment where children were either going to schools or returning from schools, and everyone really was in state of shock. At that moment, about 60 jet fighters, they took that first attack. And then the 2008, 22 days of offensive took place. Some people asked whether this is the same or not. Perhaps it's the same, but there are something that is really different. It happened in a single minute or in 2 minutes, and it was across the whole Gaza Strip, which is about 300 square kilometers. I think it's about 240 square miles. But what happened in those 11 days is that it happened repeatedly in more than one evening, where for about 25 to 30 minutes, sometimes to 40 minutes, you hear continuous bombing in your own city, in your small geographical area. That continues for about 25 to 40 minutes, where you don't have neither you, your children, women, wife, etc., not a single family member would really feel the chance to just take a breath, to just feel some rest. You'll just continue for about 25 to about 40 minutes, depending on which place, the continuous bombardment and shelling. And that continued in different cities, in different nights, where no one really could feel any safety, any moment of safety, which means that your nerves, your nervous system was at its highest, let me say, alarm for more than 25 minutes. This is the most, I would say, fearful experience that I had throughout those different escalations, whether these were the large offensives, we speak about 3 and now the 4th, or whether about things that were happening from night to night, every now and then. Now, that really caused extreme fear to the 2,000 million population. The other thing which is different is that, most of the areas that were attacked were in the heart of the cities. We speak about leveling up towers well, it's not towers, it's like 12, 13-story buildings that were leveled to the ground for example, in Gaza City, 3 or 4 of them. About families, some of the families were just killed during those attacks. In the Shatay camp, a family of 10 people got killed, including 8 children and 2 women. Everyone was killed in that attack. So the fear, the terror that is felt through the 11 days was something that unprecedented. We were not ever exposed to such a thing. What does that mean? In 2014, when the ceasefire took place, we sent our let me say, psychological first aid teams or crisis response teams to the community, because immediately we form a team of a male and a female, a man and a woman psychologist, and they just go to spread in the community in order to see what are the difficulties and how people are coping. There were many difficulties, but to speak in short, children, the main issues with the children was the feel of extreme fear, that was translated into either irritability. Child can hardly stay still, they would cling to their parents. They look really irritable sometimes. They stop being obedient, let me say. They do not listen. They do not respond to their parents, And then you speak about night horrors, night terrors. A child would wake up in the middle of the night just screaming without remembering anything. And then you speak about bedwetting. Unfortunately, it's something that is common after such offensives. And some children develop a full, let me say, picture of PTSD, post-traumatic stress disorder. When it comes to adults, especially women, they start to complain from pains, pains in joints or low back pains, sort of somatization, some somatic pains. But later on, men and women start to show symptoms of PTSD. In 2015, most of the people who received, I think 40% were with PTSD, 35% were with depression. When it comes to children, about 80% were either with PTSD or with bedwetting. So that's what we had in 2014, after 2014. At that time, UNICEF said that there are more than 370,000 children who are in need for some kind of mental health intervention. That was in 2014. I think now, looking at how things were happening, I'm sure that more than that count of people is in need of some kind of intervention. In 2014 and 15, when we were visiting the homes, about 20% of the people whom we visited, we felt that they need to be referred to our community centers for further treatment, further counseling, further, let me say, assessment and treatment. Now, I'm sure that this amount is really expected to be more than that. It's not only about this. Let's remember that, in 2014, about 500,000 people got displaced. In 2021, lesser than that. I think it's about, it's about 80,000 people who got displaced, and they were displaced to 58 on our schools. Now, the number of residences that were destroyed, we speak about 1,000 housing and residential units that were completely destroyed. We speak about 770 housing units that not anymore inhabitable. So about, I don't know how many thousands of people, but they will not find place to return to. Now, being about 77, 80,000 people who were in schools, let's just keep in our background the issue of COVID-19. It was still there. People were afraid. They were terrified. They were not taking any measures. They were just escaping home without even having anything with them, not even clothing. Yesterday or today morning, the Ministry of Health released the results of their testing, the COVID-19 test for today. They said out of 291 tests that were made, 110 were positive. That's almost more than 1/3, actually. I think it's about 37%. And in a population of 2 million people, only 291 tests were possible to be made. That's how things are difficult. So what we expect? Really, we expect a huge need for mental health services, especially among women, especially among children. And also we expect another peak of COVID-19. And we are not sure really how the health system is going to cope with those difficulties in the coming few weeks. Thank you very much for giving me the chance. We are going to try our best as in Gaza Community Mental Health Program. But again, the need is to put an end to this kind of offensive, to this type of irrespect to the human law, irrespect to how people under occupation should be dealt with. After all, we are people under occupation. There are international laws that govern how we should be dealt with. These laws were never respected. So at least if justice is not going to become soon, if we are not going to get our freedom soon, at least the international human rights laws should be respected. Thank you very much.
Thanks, Yasser, for filling us in really on the latest. And I had someone mention to me, yesterday that how COVID is the least concern, but as you just brought up, 80,000 people displaced into tightly packed UN schools, and already 37% positive rate, and they're only able to do 1/10 the amount of testing they were doing 2 weeks ago, and even that was insufficient, of course, because like you said, there was only one testing center. I mean, what can you say? And I want to move actually to sort of a final question that I would like each of you to touch on, and then we'll see if there's some time for Q&A. And I'll start with you, Weeam, this time. But I want to start to now face forward and think about. And Rashid, I know when you mentioned some of the things that sort of felt different this time, but to think about, not just what is different in 2021, but what you think can be done differently. What should be done differently? What are the ways forward in this situation? So reasons for despair, reasons for hope. Would love to get your insights into where things go from here. 12 hours after, or whatever it is, 18 hours after a ceasefire that was already violated by Israel, by the way, and attacks on Al-Aqsa Mosque this morning. We'll go ahead and start, Weeam.
Thank you, Bram. And I think it was really important to actually hear from Yasser, who's been on the ground. So I think in the immediate period, obviously there's going to be the more direct relief efforts. But one of the things that I want to stress, and I think this is one of the things that Rashid alluded to early on, was there is a shift in conversation. There is a shift in terms of like the framing. We are seeing these global movements, including, and I think also these parallels with the US, and especially with the tremendous work that's been done, for example, by like Black Lives Matter, by indigenous movements and other movements and and other groups within the US. I think they've really helped in kind of laying that foundation for a shift in discourse. And and so much of what has actually been happening, there are very clear parallels. And I think that's like, now it's also important to shift the conversation away from like strictly focusing on kind of that more immediate relief and humanitarianism. And this was also something that was quite commonly actually brought up in a lot of the social media conversations from people in Gaza, and also just like Palestinians in general, is that we're not looking for pity or charity. And I think one of the issues is that there's been so much money that's been put in like on different fronts, and a lot of it maybe not spent very efficiently, but it's money that's been used to numb and kind of like subdue the conversation. It's not money that's actually been used towards any real development or in addressing the structural barriers. And I think this is a time where that conversation, and in thinking about public health and thinking about even just these broader conversations around decolonization, social justice, inequality, and whatnot, these are shifting, and it's important to actually bring that, bring the Palestinian experience into that conversation. And I was actually think about also the responsibilities of global actors. We've seen really strong statements, for example, from different health organizations. There's the group that's affiliated with the American Public Health Association, the Palestinian Justice Caucus, but also with like the People's Health Movement and others. But at the same time, we haven't really but I think we need to also push the international agencies further, because Israel bears a responsibility and causes all this destruction, but at the same time they're not the ones paying the price. All these other organizations are coming in, providing immediate relief, which is important to an extent, but it's not sustainable. And I think we have to work on multiple fronts. We have to shift that discourse to really talking about the causes of the problem, the structural determinants, the political determinants of health, and also think more about sustainable system building that is predicated on justice and reducing inequality, rather than entrenching it both within Palestinian society and between Palestinians and Israelis.
Thanks so much, Weeam. Go ahead, back to you, Yasser. Thoughts about what you're thinking about for the future. You're probably mobilizing your organization, but just any kind of thoughts about where you go from here. I mean, if you can even be focusing on that right now.
Well, we started from day one actually thinking what we could do. It's ironic, but this is going to be our let me say 6th crisis response plan in Gaza Community Mentality Program. We are an organization that was established in 1990, as Dr. Rashid said, by Dr. Yasser, who was a human rights and a psychiatrist, a well-known Palestinian person. But since 2008, it's already 6 crisis response plans, 3 because of the attacks in 2008, 2012, 2014, 1 due to the Great Return demonstrations, and then due to COVID, and now the 6th due to the current or the latest offensive. What we already plan to do is to extend our toll-free line. We have a toll-free line that operates from 8 a.m. to 8 p.m., including weekends. So our first plan is to make it available that 3 operators can work at the same time. People who answer the phone lines are not just counselors, but they are our experienced psychologists. So they immediately can give advice to the most critical conditions, to the most needy people. We still have some sort of stigma in Palestine, like in many other places in the world, regarding mental health and seeking mental health service. So that's why some people will only call you and not even think of coming to you. This also applies, unfortunately, to many women who are just afraid from stigma just to go to a community mental health center, or to some men who are afraid just to speak about their, their pride. I would say pride will not allow them to speak about their weaknesses and the difficulties they are facing. Another thing, which is to, again, as I said, to start another crisis response teams. We would start with 5 teams. That's 10 people who will be visiting the most affected areas. They will be visiting hospitals, providing psychological first aid, detecting cases that are in need for the further intervention, and refer them to our community centers. From tomorrow, we are going to return to full work in our 3 community centers. Last year, we saw about 3,200 patients, but we managed to help more than 16,000 people. In 2015, immediately after the 2014 attacks, we reached about 3,700 people reached our services, and another 25,000 people benefit from us. Look, the figures are, they seem to be small when we speak about 2,000 or 3,000, but this is just a reflection of the most needy, most marginalized people who go to your service. Because a lot of people will really try to go to a psychiatrist as their last resort. And let's keep in mind that our best supporter in our work is simply strong family support, strong network about the population, and strong faith in justice, faith in religion, faith in the course that this is going to reach freedom one way, that this injustice is not going to continue forever. And this is going to be, again, a tough task for our mental health professionals, because there isn't really that much that we can do to change the realities around us. There isn't really that much that we can do to bring justice. There isn't that much that we can do to make people more, to have better economic conditions. There are a lot of things that are not in our hand, but still we can, and we are trying, and we succeed in bringing some candles and lighting them in the hearts and the lives of people. And then we get really some sort of success that we are happy about. It's sometimes the best thing that you could ever do is to bring a child back to his excellent performance at school, bring a father and a mother to become again active in his society, taking care of their children. Thank you very much.
Thanks so much, Yasser. And, the really poignant, that sense of what can we do, what can't we do, right? And I think, I want to turn to you, Rashid, now, and thinking about that final piece, what is there to do, right? Third states have not held Israel accountable for crimes against humanity, for the crimes of moving a settler population into occupied territory, all of these factors, right? And in fact, in the case of the United States, where we both are now, been quite the opposite, have been supportive. So, you mentioned some things that maybe seemed a little bit different this time around. Where do we go from here, and what role is the U.S. in all of that?
Yeah. Well, I don't know if I can speak about how we actually get out of this situation of stasis, of horribly negative stasis. It is clear to me that the situation is changing. Whether it's a long-term change or not, I don't know. I have a long memory. I lived in Beirut in 1982, and what we have been watching in Gaza, we used to see in Beirut. The Israelis did exactly the same thing in Beirut in 1982 that they've been doing systematically in Gaza for 4 rounds now. And one of the things that one of my dear colleagues who's now passed away, Amy Kaplan, said was that during each one of these incidents of extreme violence against Palestinians, each one of these instances of extreme violence against Palestinians, international public opinion was shocked and moved, and there was a change in the narrative. But that was repaired with assiduity by Israel and its friends in the United States after 1982, after the 1987 First Intifada. I could go on and on, after 2014. That may happen here. So take with some salt what I'm about to say. there will be an attempt to rebuild the wall of lies that protects Israel's actions in the mainstream media and in American politics. But I think that in addition to what I already said about the narrative changing and the Palestinian narrative getting out much more, which is happening because Palestinian voices are beginning to be listened to. Mohammed al-Kurd was all over the media. I have never seen a person about to be expelled from his or her home on the American media. It happens all the time. It happens. I have many relatives who've lost Jerusalem residence. They're never interviewed. I know many houses that have been taken over since I started visiting Jerusalem back in the late 1980s. Nobody ever talked to them. So that's new. And there are many, many news people working in the media, younger ones, who are Arab American or Muslim American, and who have a completely different perspective than the much older editors and producers who control content. So they're beginning to feed up things that never were accessible through the mainstream media. As a result of all of this, I think that it seems, this may be reversed, but it seems that international public opinion in many respects is changing. American politics in some respects are changing. And this is particularly true in the Democratic Party. And this is particularly true where younger people are concerned. This is particularly true where minorities are concerned. There's a trendy word called intersectionality. Well, that's an academic term. What actually is true is that people in Ferguson got advice from people in Palestine about how to handle the tear gas canisters manufactured by the same American factory that were fired in Ferguson and that are fired at Palestinians. That's not some trendy academic buzzword. That is how people saw that what was happening to them was similar. Palestinians in Israel have been discriminated against. They have voting rights. No Palestinian has ever been a member of an Israeli cabinet. No Palestinian has ever had any voice in any decision ever made by any Israeli government since 1948. It's sort of like Jim Crow, and people understand these things. They understand that they're different, but there's a connection. And so I'm thinking that there really is the beginning of a change, at least among younger people in the United States and globally. I mean, I'm just waiting for Palestinian Lives Matter to be stuck up on walls along with Black Lives Matter. It's true. These are the people whose lives are the most devalued, as is the case in American cities, where minority populations in general and Black lives in particular are devalued. Another change that I don't know if this will continue is that there is a high degree of Palestinian unity. The strategic objective of Zionism since the beginning has been to shatter the unity of the Palestinians, divide and rule, divide and rule. Julius Caesar to Lord Curzon to the Israeli government. It's what every colonial power must do in order to maintain its rule over a subject population. And that's what Israel has done, aided, in my view, by the incompetence and corruption and short-sightedness of Palestinian politicians in Ramallah and in Gaza, who put their own political self-interest ahead of the national interest. But it is an Israeli objective. One of the things that's been shown is that at a time when the Palestinian political factions were unable to agree on elections, and Abu Mazen prevented them, everybody across Palestine, inside Israel, in the West Bank, in Gaza, in Jerusalem, were marching at the same time on May 15th, for example. And were moved, as were Palestinians in Lebanon, as were Palestinians in Jordan, by exactly the same issues, exactly the same sentiments, exactly the same disgust with the paralysis of the political leadership. I'll say two other things that have changed, and then I'll say a word or two about what might be done. One myth that was shattered by what has happened over the 6 or 8 weeks that have passed is that the Palestinians are irrelevant, that you can ignore the Palestinians. You can get the absolute monarchy of the United Arab Emirates to do a deal with Israel and nobody cares. Well, people care, not just Palestinians. It's people all over the Arab world who care. Go back and read about what the khutbah on Friday in the Egyptian mosques was. State-sanctioned sermons last Friday, not this Friday, last Friday, Have a look at what social media is saying in the Emirates and in Bahrain, the countries that have normalized with Israel. Look at what's happened, the change in Lebanon among politicians who were critical of the Palestinians and hostile to Hezbollah, and have now just, public opinion has shifted in many parts of the Arab world. The Palestinians are clearly not irrelevant. Their issue cannot just be swept under the rug. It will not go away just because United States and Abu Dhabi and Tel Aviv want it to go away. The other, and with that has been shattered the myth that the Arabs don't care about Palestine. The Arabs pretty clearly do care about Palestine. Their rulers may not care about Palestine, but their undemocratic rulers don't represent them. They represent their own self-interest. They represent the kleptocracies that are stealing the wealth of their countries and starving their people of proper infrastructure and education and so forth. So I think those are changes that may or may not be reversed, but they do seem to have been among the results of this. Now, what can be done? I think that there might be an opportunity to focus on the specific suffering of Gaza. And by that, I don't just mean rebuilding everything that's been destroyed yet again so the Israelis can come back later and destroy it one more time. I mean, doing something fundamental about the conditions in Gaza. And I have very little faith in the American political system. I have no faith in the retread policymakers whom the Biden administration has recruited to serve in its foreign policy team. But the situation may force them to do something about the siege. It may force them to do something. It may force them, for example, to understand that Palestinian disunity is a problem for them. It's not just a good thing for Israel. It's actually a problem for the United States. That you cannot ask a so-called president who is 12 years past the expiration date of his mandate to negotiate when he and his entire administration in Ramallah are completely discredited. There has to be some new leadership. There have to be ultimately elections. The United States did not want elections. Abu Mazen was partly responding to cues from the United States. He's been in intensive conversation with the Biden administration since it was elected in November, with the transition team and with the administration since then. Quiet, under the table discussions. They did not want elections. That was a stupid mistake. That's one of the things that contributed to raising the temperature such that what happened in Jerusalem had the amplitude that it did, and such that Hamas was able to take advantage of the situation by firing rockets after launching an ultimatum about Jerusalem, of course. So that's one thing that can be done. And there are many other things that can be done. Conditionality on US aid to Israel. American weapons to the tune of $3.8 billion worth every year are delivered and should be subject to the laws on American weapons sales, which include they not be delivered to countries that violate human rights, and that they be used for defensive purposes. Now, you hear American politicians bleat about, from the president on down, that Israel has the right to defend itself. If Israel were not defending itself, it would be illegally using American weapons. So they have to say that, not just because it would cause problems for Israel, it would cause problems for them. They would be violating the law by selling weapons that are not used for defensive purposes to Israel. Now, how killing 242 people, of whom about half were old people, women and children, is defensive, it's indefensible to argue that. It's impossible to argue that. And that argument should be had, as should another argument, which is that the activities of groups like the one that was operating in Sheikh Jarrah, and that operate all over the occupied territories, all over the West Bank and occupied Arab East Jerusalem, are in many cases supported, as are major settlements all over the West Bank. Ariel University, there's an Israeli university in a settlement, a big settlement in the northern part of the West Bank, are in many cases supported by American organizations that style themselves as charitable organizations and have 501c3 status, such that contributions to the illegal settlement, the settlement of Palestinian land by people who are violating international law, is tax exempt. This is something the Treasury Department could deal with literally with the stroke of a pen. It doesn't require legislation. Just deeming these organizations not charitable organizations. You want to give money to them, fine, but you're not going to be able to deduct that from your taxes. These are the kinds of positions that even the Biden administration could begin to take, to argue, just to state, East Jerusalem is occupied territory. Settlement activity in East Jerusalem is a violation of the Fourth Geneva Convention, which states that occupying powers may not transfer their population to occupied territory. Just say those words. That's law. This is not, rocket science. This is not, they would not be inventing something. They would simply be stating a fact, and that would send shockwaves through Israel. Now, we have a divided political system. The Republican Party is in favor of settlement, is in favor of crushing the Palestinians, agrees to everything that Netanyahu does and has done and will do. They're more Zionists than the Zionists. And that the situation in the United States, of course, may change. And this administration is worrying about the midterm elections more than it's worrying about Palestine. So I'm not terribly optimistic than any and certainly about all of these measures being taken. But those are things that can be done, and those are things that people in the United States can tell their representatives that they favor. I don't think that we are at a turning point in the entire conflict, but I do actually think something either has changed or may be beginning to change, and it's worth pushing in that direction. Sorry.
And I think that turning point thing is I want to touch on real quick, because, in addition to language, which I think is important, right? There's certain taboos been lifted, right? Apartheid is in many places, including, U.S. Congress, where it's never been mentioned before. You use settler colonialism in your Washington Post article, like hadn't seen that before, right? So these things are now suddenly sort of mainstreamed in a new way. But I also want to touch on the fact that, we didn't really touch on Palestinian citizens of Israel and the widespread, and Weeam, I would love to hear from you on this, the widespread Palestinian solidarity across all the colonial fragmentation in these different territories that again has much precedent in other parts of the world, but had been sort of more successful until now. And what has, I think, at least to give me some degree of hope is in both within Palestine and then outside, is that there seems to be a growing movement upstream of the kind of changes that are much needed in policy that Rashid just mentioned, but that might be the beginning of being able to push on those in a new way. And so I'd love to hear your sense, Weeam, on the ground in the West Bank. What has that been like? And your sense, I know you're in touch with a lot of Palestinian citizens of Israel as well.
Yeah, thanks. So I think, the situation right now is still very fluid, and but there are indicators that are actually quite positive. And one of those, for example, one of the more recent ones is the May 18th strike that actually happened a few days ago. And this is, and from the beginning, and this is maybe one of the things that's actually been quite distinct about this period, the unity of Palestinians that have been fragmented for various reasons, including because of also external pressures. But so this strike was actually remnant of the general strike that was actually called in 1936 and by all Palestinians, and this was and that was still during the British Mandate. And so we also do need to think about that broader history. And the call came out of 48. It came out of Haifa, but it was quickly picked up, and it was quickly picked up by Palestinians within the West Bank. I'm Gaza too, but at the same time also they were being bombed. So but and it got to the point where the discredited and corrupt and whatever Palestinian Authority also basically had to actually allow for their public employees to take part in that strike and had to take, and join forces. What we're seeing now is that there is a united discourse that I think social media has actually played a really important role in this, in the way that especially young people have been using social media to mobilize. It's also important to remember that there has been a targeted silencing campaign that's also been pushed by social media giants, where content has been erased, people have been blocked from accessing, but at the same time, we see tips being shared about bypassing algorithms. There's all sorts of things that are being used. And so what we do have, I think what it is, We do have this, I mean, they're constantly referred to as kind of like leaderless protests. And I don't know, I mean, I'm ambivalent about that term, but we have calls for unity. We have calls that actually stress the unity of Palestinians. There was a manifesto of sorts, which was calling this the unity intifada. And they had like, they called it, the statement of dignity and unity. And so that discourse is not only changing on the international scene, but it's also changing within Palestinian society. And I think this is actually really important because there is a lot that needs to be fixed internally, and there's a lot that actually needs to happen. And I think even like Oslo obfuscated that to a large extent. And I think it also, and I mean, we don't really have time to get into this too much, but I think also it's been very clear in the last couple of years and in the last decades, it offers young people very little. And we used to see this a lot in the work that we were doing, even in some of the work that we were doing on like youth well-being and other work. They constantly talked about like the lack of horizon, the lack of any sort of real space for participation for all these other things. But now what we're seeing is that they're creating these alternative spaces. They're not even engaging with this corrupt political establishment that exists. They're completely bypassing it. They're like irrelevant. Where that goes, I don't know, because the thing is, there is also this worry that it's going to be co-opted. There are people that are expecting, arrest campaigns to be pretty widespread in the more recent period, both by the Israelis and potentially even by the Palestinian Authority. So I think there is momentum. We do have to try to do what we can, but it's going to be, I mean, it's a long march to freedom. It needs a long breath, whatever, but like there's a lot of work to be done, but we are seeing things that are uplifting, and I think they're actually quite unique. We haven't seen this kind of mobilization in a very long time.
Thanks so much, Weeam, and thanks for really making that clear, kind of what's happening now and how it's going outside among the youth, outside of these traditional channels. I reminded a bit too of the Great March of Return, which started, in 2018 on March 30th on Land Day, which is commemorating, a massacre and a land theft in the Galilee, right? So for Palestinian citizens of Israel, right? But that march was started, of course, in Gaza, and of course had aims of protesting all the things that we've heard today. Yasser, I want to give you, I want to just say a couple things too, which is that there are many statements out right now from public health and medical personnel in solidarity with Palestinians and condemning the attacks. And so I want to encourage all the medical and health folks out there to seek those out, one from the Palestine Working Group, from the APHA, and others, and certainly to consider supporting the incredible work that Yasser is doing with the Gaza Community Mental Health Program. And Yasser, I want to just give you any last word. We're here down really to the last couple of minutes, but just to hear from you and from your experience in Gaza.
Thank you very much, Bram. I think I would just reinforce what you said already. One of the most difficult feelings is that when you feel that you are left behind. After each offensive, you see a big, during it there is a big show in the social media, let me say, in the world networks and the TV programs, etc., etc., etc. And that continues for a few weeks after the ceasefire takes place, and then you hear a lot of promises, not only about rebuilding, but the promises of a change on the ground. Since 2008, or beginning of 2009 till now, it's already 12 years, no change really happened. The blockade didn't really end. The living and the suffering of the Palestinian people is already there, especially in Gaza Strip. In 2012, that's 4 years after 2008, the United Nations said that Gaza is not going to be inhabitable anymore by the year 2020. 2 years ago, in 2018, 3 years ago, they said, well, we were optimistic. It's already uninhabitable, So nothing is really changing. Things continue to be as bad as they are, and they even get worse. So at least from the professional community, from the community that we belong to, as for example, mental health professionals, as health professionals, as human rights, as the free world, to stand in solidarity with the people in Gaza is something that we really need. That's something that we really appreciate, and it gives a feeling, a sense that you are not left alone. And we encourage everyone to be part of any movement that would bring more solidarity to the people in Palestine.
Thanks so much, Yasser. That's a perfect way to close things out. I want to thank you, Weeam, you, Rashid, and you, Yasser, and the FXB Center and our other co-sponsoring centers for listening in today and moving this conversation forward in a way that I think is really important. And this video will be available soon. We'll send it out.
Thanks.
Thank you.
Thank you very much.